If one were to examine the state of our nation as a doctor would evaluate a patient, there would be both a diagnosis of the condition of our national health and specifically the condition of our health freedom in our nation. And today on this program, Pastor Isaac Crockett and I will begin a two-part conversation with Twyla Braze, President and co-founder of Citizens Council for Health Freedom, where we'll look back and around at the condition of health freedom in America and diagnose it, and from that standpoint, our national health. Now, next week, we'll talk with her about the prognosis and the prescription necessary for any healing to occur in our health freedom diagnosis, which we'll do today. Twyla is a recurring guest on our Stand in the Gap Today international radio program on the matters of health freedom in America. And from my studied opinion, she's likely the most expert, singularly focused person and leads the most effective organization on the issue of health freedom and the strengthening of the doctor-patient relationship here in our nation. We're glad to have her with us today. Now, what makes this program necessary and why I believe that you'll be edified by these two programs is that truth in this nation has been under aggressive and strategic attack since well before, frankly, the mid-20th century, when the institutions of government and Congress itself, the executive branch and the courts began to repeatedly defy God's standards for morality and justice by throwing out the Ten Commandments, declaring illegal praying to God by our public school students, and then redefining life, marriage, and human sexuality, to name just a few. Pragmatism, greed, pride, and the lust for power replaced truth and justice. Bribery and corruption became institutionalized, as we are now seeing. Now we are, in fact, seeing in the early months of 2025 the depth of this fraud and corruption and immorality and literally treason. But these are the consequences of rejecting the fear of God. As a result, the pillars of truth and justice necessary for freedom in a free society, including the area of health freedom to survive, have been hollowed out as if by termites. National health freedom, like patient health, changes from time to time, of course. So for those watching, we're recording this program in the end of February 2025. So bear in mind that as you watch this program in early to mid-2025, or perhaps in 2026 or later, the benchmarking of health as of today will make this program and the content of great value. Let me bring in right now Twyla Braze, President and co-founder of Citizens Council for Health Freedom, as we consider diagnosing the state of health in America 2025. And with that, I welcome to the program right now Twyla Braze. Thank you for being with Isaac and me today. It's a real pleasure to have you here with us.
Well, thank you so much, Sam. It's always great to be with you and your folks. You have great questions to ask.
Well, you have great answers to give, so it's a mutual thing. And let's get right into it, Twyla. Between these two programs, we don't have a lot of time, and we could spend days, and you do. But let me just ask you this question just to get a perspective. I'm doing this in terms of like a doctor. You're not a physician. You are an RN. You've been practicing, but you're basically applying your mentality to this entire concept of health freedom. So I'm going to ask you, like a doctor, I'd like you to make a diagnosis. If you were to describe on a scale of 1 to 10, with 1 being comatose, dead, and 10 being of perfect health, looking at these two areas of doctor-patient health relationship, which we know is so critical as a pillar of health freedom, you do so much work on that, that one, and then the other leg, I'd put it, the overall integrity of the healthcare system in America. If you could kind of wrap them together, scale of 1 to 10, 1 being comatose, 1 being totally healthy, where are we? How would you rank us in America, and just briefly, why?
Well, I think we're at somewhere between 3 and 4. And that's because, it's just a very bad place. But, a lot of people are clueless. Like in Canada, people who say that their system is great. Well, those are the people who aren't trying to use their system, who aren't waiting 2 years. And much like here in America, the people who aren't using the system think, they've got this great coverage, they've got great doctors, and they don't actually understand what's happening below the surface or what it's like to really be a patient in need of care in America. So some of the reasons I think that we're in trouble is because doctors are focused on on paperwork and their computers, not on patients, because of the regulatory structure that has come over the entire healthcare system. Touch is notably missing. Eye contact is rare. Visits are short. Insurance really isn't insurance anymore. We have health plans, which is prepaid care, which I call the corporate version of socialized medicine. So they get all this money from you and from your employer and from the government. But if it's a health plan, they have the right to deny you access to care that you need. They have the right to call it medically unnecessary. And they have the right, as a result, to profit significantly off of denial of care. And so I think we're in a situation too where the exam room has become a place of surveillance, a place of data collection, not just on what's the condition that you're there for, but everything in your house, your home, your life. It's called social determinants of health. And there's these extensive questionnaires. And it's all been being added to a record that will be forever and shared with all sorts of people at a time where you're really vulnerable. So it's a real problem that we have today in healthcare.
Okay, you just hit on some major points, which we're going to cover more so in this program and next. Ladies and gentlemen, stay with us. Twyla Braze, our special guest today, diagnosing the health of health freedom in America. We'll be back in just a moment.
Truth, flexible or permanent? The Bible, ancient history, or powerfully relevant? Culture, a reflection of enlightenment or warning signs? The pastor, commentator, or frontline combatant? Every day, American Pastors Network speaks to these questions where and when they matter. With hundreds of affiliate radio stations nationwide, a website and mobile app screening today's headlines through the twin lenses of the Bible and the Constitution, educating, informing, equipping. This is the American Pastors Network. The time is now to stand in the gap for truth.
Watch Lighthouse TV wherever you go. Available on Roku, Amazon Fire TV, and Apple TV. You can view our in-house studio productions on demand, or watch what's on the station right now with our 24/7 live stream. Search Lighthouse TV online on your streaming device, or go to our website for more information. Visit lighthousetv.org to stay connected. There you can find out what's currently on the air and coming up. How to watch in your area on cable, satellite, broadcast, or streaming devices. Watch past programs or our live stream. Follow us on social media and learn more about the station, our hosts, and our programming. Lighthouse TV, positively different.
Welcome back to Staying in the Gap. And on this program, as we're looking at diagnosing the problems with the health here in America, we have Twyla Braze from Citizens Concern for Health Freedom, Citizens Council for Health Freedom. And Twyla, you were just talking with Sam, and you said if you were to give a grade or a diagnosis between 1 being very poor, 10 being very good, you said right now nationally we're probably at this like 3 to 4 spot, which is not good. I mean, I guess it could be worse, but it's not very good. There's a long ways to go. And so you just listed off a bunch of reasons, and you've talked about this on a radio program quite often, and even here on our TV program before. But let's delve into the evidence of this diagnosis. If I was sitting in an exam room and you're telling me as a medical professional that my health isn't very good, you would have reasons for it. And so you have a lot of reasons. Let's start with the relationship between doctor and patient. This is an extremely important relationship, really almost a sacred relationship. And for us, with the biblical worldview, we see this holistic approach to everything, that even our spiritual health is connected with physical well-being, and how important it is if we're going to put our bodies as a living sacrifice, as Paul tells us. Why is it so important that the doctor relationship? What's the problem, I guess? If you were to put your finger on the pulse, where's the problem coming from with our doctors and patient relationship?
Well, of course, Jesus, the great physician, this is elemental to our faith, but also just to the fact of healthcare in general, because it's all about a patient. And then the practitioner needs to care, primarily for the patient, not thinking of other things like corporate structures and value-based and quality metrics. And so we have today doctors who are focused on things that are not the patient, because they're not going to get paid if they aren't focused on these other things. And so, I like to say that the mission of medicine has been taken over by the business of healthcare. And you can see it in the exam room. You can see it by the fact that the first thing you're given is paperwork when you walk in. And so this is a problem of trust in the exam room, thinking, is the doctor really on your side? Is the doctor really listening? How many minutes do I have with the doctor? Can I have a frank discussion? Where will the data go? You'd like a relationship that has some longevity, so you don't have to explain, and so that the doctor can put 2 and 2 together and realize, oh, it's actually this that is wrong. But if you've only got 5 minutes, or even 10, you might not even get to that point. And then, confidentiality, outside control of the exam room by the third parties. The patient's really a cog in a corporate system today that keeps the profit coming for those who are making a ton of profit off of this patient-doctor relationship. But it's not a patient-doctor relationship. It's really just a corporate transaction that happens because of third-party payment, because the patient's not paying the bill and the doctor is waiting for somebody else to pay the bill and doesn't even know if they'll get paid for the care. So there's a real problem. And healthcare is all about the patient and taking care of the patient, caring for the patient, and doing everything that's possible to make the patient well, or to die, with as much comfort as possible. And so we have a problem with that in this country.
You've talked a lot about electronic health records and how that has, and I like how you phrased it, it's no longer really this doctor-patient relationship. It's a transaction between a corporation, and these corporations are getting larger. It seems there seem to be fewer actual doctors out on their own. Everybody's tied into some bigger entity, and these big corporations have more of a say than individual doctors or patients. And you've talked a lot about how electronic health records adding to that problem. Could you kind of explain that to us as well?
Yeah, so in this corporate transaction that's going on, it's really because of a government law that mandated, several government laws that really took everything out of the doctor's hands. And one of them is that they are forced to have an electronic health record, essentially a command and control system in every exam room and at every hospital bedside. And those electronic health records are populated, so everything that's in them is put in there by the corporate system. And so that if the hospital doesn't want to spend a certain amount of money because they get more money back they get a kickback from the government if they reduce their spending. So if they don't want to spend more money, they will put things into they will keep things out of the electronic health record as options for ordering. And so the doctors, in order to order anything, have to use the electronic health record. There's a menu, and if it's not on the menu, it becomes very, very difficult. Even if the doctor knows there's something that would be better for you, if they can't find it on the menu, on the order menu, then getting it for you is an entire process of appealing to the hospital, to put that on there. If your health plan doesn't pay for it, the electronic health record will probably say that sort of thing. So it's not even an option. And so, we all want doctors who care and think, but the electronic health record is really taking the critical thinking out of medicine and leaving you with standardized one size fits all protocols, the protocols on the computer, which may not work for you. And it's not good for medicine to have a corporate entity who doesn't care at all for you, just having a system, and your doctor only gets to pick what they can and cannot do from there and be penalized perhaps for giving you something that the system doesn't want you to have.
Twyla, before I go to the next question on socialized medicine and Medicare, which will be, I know that'll pique people's interest right now. I got to ask you a question on it. I want you to clarify from this perspective. A doctor, when he writes down the information about you, he has a written record. Is the problem that it's information that is recorded electronically? That is the problem? It's not just writing down information, because the doctor can't remember everything about a patient anyways. Put your finger on the exact problem that you're referring to.
So as a reminder, I am a nurse. I was an emergency room nurse, and we had records, and we wrote a note about the patient, and we did it all on one sheet of paper on one side of the paper when they came in. And so a doctor could just look at this and go, okay, here's objectively what the nurse sees. Here's what the patient said is the problem. Here's the nurse's assessment. And now I know basically, boom, what's the summary of the patient before I even walk into the room. But nowadays, this is not true. It's a bunch of checklists and it's a bunch of screens, and you don't actually you can get lost in the screens. So there's two things. One is the fact that when it comes to ordering, there are defined protocols available in the electronic health record. And so you're limited to whatever is available for you to order. But the other thing is that doctors get lost in the record. Nurses get lost in the record. There's so many things that they will just click standard or not applicable or whatever. And if you ever get a copy of your electronic health record today, you'll see all these pages of nothing. And they're not even necessarily clicking them all. They're saying within normal limits, within normal limits, within normal limits, within normal limits, and they haven't even checked all those things. And so it's not really even an accurate record of what's going on, and it causes things to be missed, and it causes things to be said that aren't actually true.
Okay, I think that's excellent. Thank you for that clarification, because I think that probably helped a lot of our viewers to say, all right, I know exactly what you're talking about now. Let's go into this other. We've talked about it, but a contributing factor that undercuts the doctor-patient relationship is what you referred to and people know as socialized medicine. But you've connected that, and we have on our radio program, that the face of that is, well, Medicare is the big thing right now. Connect those two, and how is that undercutting the doctor-patient relationship?
So I think that liberals have two different ways that they would like to get to socialized medicine, and they're not sure which one they can do. One of them is just having the health plans run it, and the other one is having the government run it, which is fully socialized government-run healthcare. But the other one, so Medicare kind of shows you this. So there are two versions of Medicare. There's original Medicare, and then there's Medicare Advantage. So original Medicare is through the government directly. Medicare Advantage is giving this money from the government to the health plans and letting the health plans run it. And so as a country, there are different people on the left and actually even people on the right who say that they want a Medicare Advantage for all system. That would be Dr. Oz, who's probably going to be coming in and running the Centers for Medicare and Medicaid Services. Medicare Advantage for all is what he believes is the answer for healthcare in America. And so, socialized medicine, Medicare, it's all about the government and outsiders deciding what we can and cannot have and how much doctors will be paid for it. And what we see now with doctors, of course, is that they are leaving. They're leaving early. they're retiring early, they're finding other careers, and they're just dropping out of Medicare. So they'll take other patients, but they won't take Medicare because it pays so poorly and it requires all this documentation and regulation. So hopefully that kind of explains, the answer to your question.
Okay, it does. And ladies and gentlemen, and just for this purpose, socialism by definition is government control. That's what you liken to Medicare. Fascism is a term often used for where government controls the means of production. That's almost like Medicare Advantage. Either one of them, both of them, undercut doctor-patient relationship. All right, but 2 minutes left. Let's move to this, because this ties into it somewhat. We've referred to it, and that is the significant, probably accomplishing the Medicare Advantage component, is mergers and acquisitions that are just consolidating all of the pieces, a part of healthcare that moves it into the corporate model that you were talking about. Explain some of that a little bit. About a minute and a half left in this segment.
Yeah, so about 75% of doctors are now employees. They used to, put out their shingle. They used to be independent. They made their own decisions. Some of them had electronic health records that worked for them, not the government version of them of today. Some of them just used paper, but it was all between them and their patients. Now today, because of Medicare, because of Obamacare forcing us all into health plans, because of the regulations, Obamacare is an 8-foot stack of regulations, and that was in 2012. It's probably even higher today. And so we have doctors under corporate control. We have corporations who are deciding to have nurse practitioners and physician assistants instead of doctors. So people without medical degrees who are taking the place of people with medical degrees. And so again, the mission of medicine has been taken over by the business of healthcare, and all of these mergers have happened really because of the Affordable Care Act. A lot of small hospitals, a lot of practices, they cannot handle the cost of this regulatory regime. They can't handle the cost of the electronic health record mandate. It's an unfunded mandate. And so they have to either get out of the business or go under a corporation, and now they become owned by the corporations.
Twyla, a superb job of taking a gigantic problem and boiling it down into understandable terms. Thank you. Ladies and gentlemen, stay with us, and we'll be back for some concluding thoughts about our discussion today and a brief look ahead till next week.
Stand in the Gap is produced and recorded in the studios of Lighthouse TV. Positively different.
For over 2,000 years, pastors have carried the light of the gospel through opposition, persecution, and every flaming arrow of the enemy. But sadly, now more than ever, our nation is experiencing a period of spiritual darkness. But what would happen if churches threw off the shackles of fear and boldly stood for truth? If 100,000 pastors around the nation joined together and committed to preaching God's word no matter the consequence, pastors who are unaffected by changing times and the opinions of men, what would happen if America's pulpits became aflame with the preaching of righteousness? The great darkness from rejecting God's standards would be expelled, the prayers of God's people heard, our nation healed, and God's blessings restored. The time has come to stand.
Welcome back to Stand in the Gap. And as we talk with our friend Twyla Braze from Citizens Council for Health Freedom, I just want to let you know if what you're hearing today, maybe if this is your first time to hear Twyla on our program or elsewhere, and you want more information, you could definitely go to her website, Citizens Council for Health Freedom. But you could also go to our app, Stand in the Gap app, or to our website, and you can find transcriptions, radio programs, TV programs with Twyla, where she goes into a lot of detail, like what she's been doing today. And so Twyla, in fact, could you maybe just give us your website? I know it's been on the screen and things, but give us your website where people could go for more information.
Yes, the website is cchfreedom.org, cchfreedom.org.
And those who listen to our radio program regularly hear you on a regular basis and hear that website. But there's so much that we can do for ourselves individually, again, taking a biblical worldview approach to this, that we can do things to boost our immune system by living, a good moral life, but also eating well, what we're putting into us, thinking about it. God created us. So there's things like that. But as we finish up this diagnosis, where you said it's really not a great diagnosis right now, next week we're going to talk about the prognosis. But could you maybe open that up a little bit for us right now? Talk about maybe some of those changes that could be prescribed to fix this current diagnosis, to make it healthier, to make us better again.
So everything is going to the federal government, or starting to go through the federal government, and this is not how it should be in America. We have a 10th Amendment, which says all the powers not reserved for the government are reserved for the states and for the individuals. And we have gone so far away from that in healthcare, and that's why we have a sick system, as it were. And so, what if the government paid for your house? What kind of home would they give you, right? Why is it that you can get the best home or the best car for you? It's because you have the money and you have the choice. So, it's really important in healthcare that we get back to self-payment and real insurance that pays you cash, and then you pay your doctor and your hospital in cash. A real insurance that's just for catastrophic and insurable events, not everything that happens to you. That will bring all the prices down to the pocketbook and to the limits of those real insurance companies, which health plans are not. There has to be skin in the game, and today there's not skin in the game. We should get rid of employer-sponsored coverage, and you should get all the money. One of the ways to think about this is, do you want a 35% raise? Because that's how much you would get if you get everything that you're paying and the employer is paying back, and have it in your own hands to decide what to do with it. And we need to get back to charity rather than coercion, which is Medicaid is coercion.
And Twyla, I'm going to step in because we're out of time, but you set it up perfectly for next week. Ladies and gentlemen, thanks for being with us today. Now, we're looking at diagnosis of the state of health freedom in America. Next week, be back with us as we look at the prognosis. We'll go into further discussion of the things that Twyla's just hit. And I know as you're watching this, you're saying yes, 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 because what she described for most of us is the way it used to be when we did have the best health care in the world. So with that being said, thanks for being with us today. If you've never communicated to us, please do that. Let us know how this program has been used in your life. Helpful to us to know that. And take this information. We do this to help us all make better decisions that are more biblical, more truthful, and in the end, better for us all.